That's about 44% of our state's estimated population that's 12 years and older. We are encouraged by these numbers across the state and nationally. We also acknowledge that we have a lot more work to do. DHEC, along with our state's hospitals, doctors, vaccine providers, community partners, and state leaders, as well as local leaders, are continuing to work together to help more and more of our residents receive their safe and effective COVID-19 vaccines. Getting your shots are not only how you protect yourself, but the vaccine is how we end this pandemic and return to our normal lives. We've talked a lot lately about the perks and benefits of getting fully vaccinated. For example, students who are vaccinated, of those who are old enough, won't have to quarantine and miss out on school and sports and social events if they were to be a close contact of someone with COVID-19. School is winding down, but think about the summer vacations, summer league sports, trips with family and friends that would need to be canceled because an unvaccinated member of the family tests positive. Getting your shots helps get you back to the way things were before. While it's important to talk about the benefits of getting vaccinated, I'd like to also remind people of some of the most unsafe activities for unvaccinated people based on current CDC guidance. We know that various churches are returning to indoor worship and that people who are unvaccinated might be among those who chose to gather. While attending a large indoor church service is safe for people who are fully vaccinated, it is one of the most unsafe activities for people who have not yet gotten their vaccines. The ideal scenario would be for everyone to get vaccinated before returning to worship. Unvaccinated people who choose to gather should remember that they are at significant risk. While wearing masks and remaining at least 6 feet from others reduces the risk, it does not eliminate it completely. Any crowded venue, whether indoors or outdoors, like a movie theater, sporting event, exercise class, or festival, is classified among the least safe things that an unvaccinated person can do. For those who are fully vaccinated, each of those activities are considered safe because you've taken the necessary steps to protect yourself against this terrible illness that has killed nearly 600,000 Americans, including more than 9,700 South Carolinians. We know how eager everyone is to begin enjoying summer in our beautiful state. For those of you who are fully vaccinated, it is safe to do certain things. I encourage you, if you're fully vaccinated, to do your mental and emotional health some good by getting out into the sunshine, getting outdoors, and enjoying the company of others who you know also are fully vaccinated. For those of you who still need to get your shots, I urge you not to wait. You're continuing to put yourself at risk for becoming severely ill and possibly dying of a disease that we know we have vaccines for preventing. The majority of people who contract COVID-19 will recover. But in our state today, we have 302 people with COVID-19 who are hospitalized, 80 of them in the intensive care unit and 43 of them needing ventilators to help them breathe. COVID-19 is still here, and it is continuing to make people sick and put them in the hospital, and people are unfortunately still dying of COVID-19. Today, we announced 3 new COVID-19 deaths in our state, 2 confirmed and 1 probable. Additionally, more information continues to emerge about the negative effects COVID-19 infection, even with mild symptoms, can have on a person's long-term health. Please protect yourself, protect your friends and family, and protect your community. We can't take care of each other, and we can't get back to normal as a whole unless we all get our shots together. Thank you. Back to you, Christy.
Thank you, Dr. Traxler, for today's update. At this time, I'm going to ask you to answer the questions that we received earlier today. The first is, what's the reaction to Moderna planning to request approval for 12 to 17-year-olds? What impact do you expect that to have? And as a follow-up, have you talked with Superintendent Spearman about it?
Sure. So we are certainly encouraged by the announcement that the Moderna vaccine is having such good success in protecting young people ages 12 and older against COVID-19. We will continue to await updates from our federal partners about the Moderna vaccine likely getting their emergency use authorization for those 12 years and older in the coming weeks. Once that EUA is issued, DHEC will notify our state's vaccine providers and the public accordingly. Having a second option for vaccinating teenagers will be great, but we encourage people not to wait for Moderna's authorization because the Pfizer vaccine is already available for those aged 12 years and older. While young people who get infected with COVID-19 generally experience milder symptoms than those in older age groups, it remains essential for everyone to get their safe and effective COVID-19 vaccine as soon as it becomes available to them. Young people can unknowingly spread the virus throughout our communities, and we still have a long way to go before we reach that herd immunity in our state and country. In addition, cases of that multi-system inflammatory syndrome for children, MIS-C, continue to be diagnosed. Currently, we're encouraging those 12 years and older to receive their Pfizer shot and schedule their second shot appointment when it's time, as soon as possible. The Pfizer vaccine has been approved for those people aged 12 and older since May 12th. Fully vaccinated children are able to take part in many of the activities that they had to stop because of the pandemic, and they won't necessarily have to quarantine and miss school and sports and other social activities. They have the known exposure to that virus or to the virus. This is huge for continuing to normalize school life. And we continue to remain in communication with many school districts, the Department of Education, about the importance of getting anybody who's eligible vaccinated and getting everyone safely back to that normal school life.
So what is the expected impact of the Columbia Place Mall transitioning to J&J on the state's completed vaccination rates? And secondly, Dr. Traxler, where are the J&J doses for the federal site coming from? Are they coming from South Carolina's inventory?
So as to the first part, the impact on it transitioning out at the FEMA Community Vaccination Center site at Columbia Place Mall, going to the Johnson & Johnson vaccine, certainly we hope that that will increase our completed vaccination rates. With it being a one and done vaccine, people will have the opportunity for the next couple of weeks to go get their one shot and have a completed vaccine series with that one shot. 2 weeks later, they can consider themselves fully vaccinated. So we certainly encourage everyone to take advantage of that, and we hope that that will increase our completed vaccination series results and rates. And the Johnson & Johnson or Janssen doses, we have received about 1,500 Janssen doses directly from the federal government to help support this transition at the site. And we have those ready to administer beginning tomorrow morning at 7 a.m. And that's, straight from the federal government. If that should begin to dwindle, we're staying connected with our federal partners to make more available to help support this clinic that the federal government is helping to support us with.
So does DHEC anticipate a jump in the number of vaccinations given at the mass vaccination site in Columbia once the Janssen vaccine becomes the primary vaccine given there tomorrow?
We hope so. The Janssen, again, or Johnson & Johnson vaccine is very effective and can be ideal in a lot of circumstances because it is that single shot vaccine. And it has a much easier storage and logistics requirements. We're encouraging anyone and everyone who is 18 and older and hasn't yet received a COVID-19 vaccine to stop by the Columbia Place Mall site beginning tomorrow at 7 a.m. To get their single shot. And again, 2 weeks after it, be considered fully vaccinated. No appointment, no ID, no insurance is needed. Just come by anytime from 7 a.m. to 7 p.m., 7 days a week, including on Memorial Day. And do remember, though, as I said, that Janssen vaccine is only available for those 18 years and older. So no one under the age of 18 will be able to get their shot at the Columbia Place Mall Community Vaccination Center site starting tomorrow. We encourage everyone who's eligible to come out and get their shot.
Vaccinated people are starting to get back to normal activities after more than a year of social distancing and masking. Since we were apart for so long, is it possible our immune systems might be a little more susceptible to other viruses right now? The reporter says, anecdotally, I'm seeing a few vaccinated people reporting they have colds now that they're out and about again.
I suspect what we saw is we're seeing normal rates, but because we have not been out and about as much for the last year, a little over a year, we did not see as many other infectious diseases, particularly the respiratory viruses that were being spread around during that time. You can look at flu numbers from this past flu season to see that, and that is because of all these protective measures everyone was doing for COVID-19 that were also protective against other respiratory viruses. Now that we're out and about more, we're encountering really the viruses that we're used to encountering. And so probably getting sick at the same rates as from those as we would have during pre-pandemic, pre-COVID times. It's just that it is a difference now to us after a year of shielding ourselves from exposure and likely not having as many of those illnesses.
So, Dr. Traxler, this next question is one that we're hearing a good bit here in DHEC Media Relations. What incentives is DHEC considering to get more people vaccinated, and how soon could they be implemented? Sure.
Excuse me. So DHEC, we are partnering with the South Carolina Department of Parks, Recreation, and Tourism, SCPRT, to offer mobile vaccine clinics at select state parks this summer. And anyone getting their shot at a participating state park will receive free park admission for that day. The partnership is going to be a great way to make the vaccine available for all of the people, both residents and tourists who visit our state's very beautiful parks. We hope to have this initiative up and running at parks across the state in the coming weeks. There are quite a number of logistics to consider, such as how we'll help to make sure that these park visitors have a date and location lined up to get their second shot, as well as, of course, dealing with the logistics of having some of these vaccines that need to be refrigerated or kept cooler, out at parks in the heat of South Carolina summers. But we're working these details out. Additionally, we also have plans in the works to partner with members of the South Carolina Brewers Guild to begin offering vaccines at certain breweries around the state. And the dates and times and participating breweries are still being finalized, and more details will be begin being promoted in the next few weeks. A few other states are seeing success with an uptick in young adults getting their shots through similar incentives, and we're very close to announcing the details of this Shot in a Beer campaign for South Carolina. We're also reaching out to local festivals and minor league baseball teams in the state for hosting free vaccine opportunities at their events. And we're also very supportive of the other creative initiatives that vaccine providers and partners around the state are starting up as part of this state's unified commitment to vaccinate as many South Carolinians as possible. The lights just went out.
Yeah, I see that. We can still see you though, so but I know that's a little odd.
They're back on.
So any concerns about the holiday weekend being a super spreader event? Do you all have protocols in place to monitor the numbers tied to this weekend?
So our protocols that are in place to monitor the numbers tied to this weekend are the same protocols that we have in place for surveillance at all times, both during non-holidays and holiday situations. We are continuing to remind all labs and providers that any test that's performed in South Carolina needs to be reported to DHEC within 24 hours, and so both positive and negative results. And so through that surveillance and that mechanism, those protocols we already have in place, we'll be monitoring to see if there's any change in case counts, tied temporarily to this weekend. The benefit to this holiday is it is one that many people spend outdoors in our great state. And so I certainly encourage people to do that again, as we know there is less risk with being outdoors versus indoors. And in addition, the higher rates that we're seeing of people getting vaccinated will certainly help decrease the chances of this becoming a super spreader event. And so I really encourage everyone that if you're not fully vaccinated, even if you're going to be outdoors, don't be around large crowds, and don't be in big group gatherings, especially with other unvaccinated people. So
Perfect.
otherwise, I hope everyone has a very happy and safe holiday weekend.
Absolutely. So how would you describe public reluctance to get their second Pfizer or Moderna shot? So those folks that are not coming back, right, to get their second series and become fully vaccinated.
Sure. We, like many other states are experiencing, know that some people aren't returning for their second shots for a variety of reasons. Some of them, even though they have a second dose appointment scheduled. To help address this, we've been using our vaccine call center to have our phone agents make reverse or outbound calls to those who are at least a few days past their due date for that second dose and haven't received it yet. These call agents are offering a helpful reminder about why it's so important to get that second shot and how you can get your second shot at a provider around you, and helping people to find that if needed. We're hearing that some people just forgot about their second dose appointment, or some had something come up and never rescheduled their appointment. And some folks are saying they didn't realize how important it was to get their second shot. Yet others are maybe concerned about the risk of side effects with the second doses. And so we're providing factual information and helping people understand the importance of getting that second dose.
Dr. Traxler, based on our online dashboard, South Carolina has received 330,000 J&J doses. 120 have been used, and another 20,000 are listed as an inventory. So where would the remaining 190,000 doses of the Janssen or J&J be?
So making me do math this afternoon, along with my lights that may or may not be working properly. So those remaining doses are likely ones that are involved in the federal partnership, either that federal retail pharmacy partnership or other federal entities that we know are vaccinating, and the HRSA sites. So those are doses that came from the federal government to those sites. We are reaching out to those partners through those federal initiatives to see if we can assess their inventories. But that's where those doses are. And so we are working to get more details about that.
So Dr. Traxler, can you address the work DHEC and health partners are making to get word out to people in Cherokee specifically about the availability of the vaccines?
Sure. And I assume that we're talking about Cherokee County.
Yeah, I think so.
Okay. So one thing we're doing in our rural communities like Cherokee County is to really localize and humanize our messaging about the importance of getting your COVID-19 vaccines. We're actually partnering with the small local newspapers in Cherokee County to run a series featuring local residents and their stories about how they were impacted by COVID-19 and why they chose to get their shots. Candy Ferdier, our Upstate Region Public Health Director, is going to be featured in the first installment. She's born and raised in the Upstate, and her team has really been working very hard to increase vaccination rates in Cherokee County.
So what are the largest issues at this point let me start over. What are the largest issues at this point to getting vaccination rates higher in mostly those rural communities, just like you mentioned, Cherokee? Is it vaccine hesitancy, ease of access to vaccines, lack of knowledge, or something else?
So I think it's most likely a combination of all of those things. I wouldn't necessarily say a lack of knowledge, but maybe some people are arming themselves with the information they need to make an informed decision about why the vaccines are so important. Our regional teams are continuing to engage with local partners, and churches, I want to say, have particularly been essential in this to help connect with individuals. Some people don't watch the news or listen to the radio or use social media. I am happy to say that our first installment of about 83,000 direct mail vaccine postcards were sent yesterday, and we're sending a postcard with important and factually accurate vaccine information to every single residence in the state as a way to make sure that every household has in their hands material that states how safe and important the vaccines are and how they can get theirs. It's also important to note, I want to say that DHEC can't do this alone. We're relying upon community leaders, businesses, and others to help us. For those of you who have received your shots, first off, thank you. Thank you for doing your part. But also we ask you to please share your story, talk with your friends and family and coworkers about why you got your shot, and help us by being an advocate for these vaccines that are going to help us end this pandemic once and for all.
Thank you, Dr. Traxler. At this point, I'm going to give our media members just a quick heads up. I've got 2 more sets of questions for Dr. Traxler, and then we are going to open it up for live Q&A. So at this time, please remain on mute, but start thinking about the questions that you'd love to ask Dr. Traxler. Okay, so can you address hospitalization trends? And here's a few follow-up questions based on this topic. Is there a measurable decrease in COVID hospitalizations in South Carolina since the beginning of vaccinations? And can you please provide some numbers?
Yes, we can get certainly some numbers, the specifics. We have seen a decrease in COVID-19 hospitalizations in the state since the beginning of the vaccination campaign, going back to mid-December. However, I do want to say that drawing direct associations between the vaccine campaigns and rollout of vaccines and decreases in cases or hospitalizations or deaths is not a simple, direct comparison. There's so much more to consider as to, how to make these inferences and how this impact might be felt. So one thing, I do want to say is the vaccine has absolutely decreased the burden of disease. There is excellent evidence of this. An example is in our nursing home and long-term care facility populations, which is basically as close to a controlled environment as we can get, given that those residents have limited exposure really only to the visitors outside or beyond their own facility. We have seen that the rapid deployment of vaccine that we did very early on with those facilities, and then we've seen a tremendous decrease in the number of cases and the number of clusters of cases that are being reported from these facilities, and from these, one of our most vulnerable populations. Correlating that out to the general population and how much the vaccine rollout has caused the impact or has impacted the decrease in cases and especially hospitalizations or deaths is still unknown. It's difficult to quantify at this time, but certainly the vaccines are decreasing that burden of disease.
Okay, Dr. Traxler, this question is about the 20 to 24-year-old age group, and I'm pretty sure the reporter is talking about vaccinations. So they're considerably lower in vaccination rates than many other groups, including those 12 to 19. Why does DHEC think this group is lower? What are we doing to address the gap? And what's at risk if this group, the 20 to 24-year-olds, if they don't get vaccinated, and why would 12 to 19 be higher if they largely became eligible later?
Sure. So nationally, this is the age group that's among the lowest to have received their shots. We're certainly hoping that by bringing the vaccine to the social events where these young adults are congregating will help us with the effort to get them vaccinated. And our partnerships, like I said, for example, with the Brewers Guild, and then I work a lot of that's being done at the regional level to make shots available, some by our partners, at sporting events and festivals and other locations, will hopefully cause an increase in that age group. The 12 to 19-year-olds, some of them became eligible later, but although 16 and up was certainly still eligible early on, but they also have been reminded some of them by family, by parents, legal guardians, et cetera, that of the importance of getting them. And so we just need to continue to remind all the young adults too that they're still vulnerable, they're not invincible, and they're still susceptible to getting infected if they're not vaccinated.
All right. Well, Dr. Traxler, that was the last submitted question. So thanks for hanging in there with lights flickering and such. We can still see you. Appreciate the early birds over on the right-hand side that have their hands raised. So we'll go. Chris, you've got an opportunity for one question. I'll circle back to you if you have follow-up. So go ahead and ask your question.
Hey, Dr. Traxler. So you mentioned 15,000 doses for this federal clinic here in Columbia. Are those doses that were already shipped to the state like months ago, or when did those come through? The reason why I ask is, obviously the number of doses has gone down to 0 in recent weeks. So I wonder, is that like a separate shipment, or I guess when did that materialize?
Certainly. And so it's 1,500, not 15,000. I just want to make that clarification. And those, my understanding is those were a separate allotment or allocation shipment. I don't know in terms of the dates exactly when they arrived. I know that we have them for vaccination tomorrow, starting at 7 a.m. And that came from the federal government, separate from what we get to the state, or try to get to the state each week.
MK, you've got a question?
Hey, Dr. Traxler, here's my question. You were talking about kind of summer plans and what you can do if you're vaccinated or if you're not. If you're a family with small children younger than 12, what kind of individual advice would you give? Like, can they go to church? Can they, even if they don't take that child with them, for instance, can they travel? Can they see family?
Sure. And so a lot of that is going to be on an individual level in terms of people assessing the risk and, of certain circumstances that they're looking, to consider, as well as looking at the people in their family, those children under 12, what their risk may be if they were to get exposed to the virus and infected, and making some of those decisions for them. They also certainly, they don't have to wear a mask if they're fully vaccinated when they're out and about. If their concern is potentially, getting an asymptomatic infection and taking it home to an unvaccinated family member, I remind everyone that to show respect for each other. And so some people may still continue to choose to wear a mask for that extra added protection and for their comfort, so that they can go out and begin to experience some of the pre-pandemic activities of the world, and do so with peace of mind, with the risk level that they would be taking home.
Jason?
Hey, Dr. Traxler, just wanted to follow up on the incentives and campaigns that you guys kind of have in the works. For somebody, sitting at home, they may ask, where is the money for this coming from? Is this coming from federal relief funds or somewhere in your guys' budget? Who's kind of paying for all of this? Sure.
So a lot of it is partnerships with various groups and with and entities. And then, especially if there is a direct incentive for individuals coming from that, it may be that the partner that we're working with is going to be giving the free admission or the free item, whatever it may be. And so then, of course, the logistics and the funding for putting on the vaccination events does come, much of it from the federal funding that we have, as well as all of the different funding sources for vaccinations. Same as, the funding for putting on a vaccination event, for example, in the parking lot at DHEC.
Dana?
Hey, Dr. Traxler. First of all, I enjoyed the town hall meeting on SCTV. I watched every bit of it. It was great. You looked wonderful. I just need you to tell me one more time, what's the percentage of fully vaccinated South Carolinians now? It's
44%.
Thank you. I'm done.
Mike, you've got a question?
I think you're on mute.
Yes, thank you. I remuted myself several times. We're 2 weeks out tomorrow from the CDC recommendations, that big change with the mask. It seems to have worked really well with no spikes or backtracking or whatever medical term is there. Is that correct? I mean, are we missing something there, or is this a success?
So, so far, we are not seeing an uptick in cases. We continue to do our surveillance just as diligently as ever, and we'll continue to do so. But we are not, right now seeing an increase in cases. And as you note, the timing, therefore, you would wonder if it was related. So, it's a good sign.
Zach?
Hi, thanks for your time, Dr. Traxler. I had a question about people who have been initially hesitant to get vaccinated, but have changed their minds. And obviously, you guys have been doing a lot of work in that regard. And I was wondering if you had felt like there was any particular methods that were more effective than others in getting people to get vaccinated, and if you had spoken to people who had changed their minds, if they had told you what the impetus for doing so was.
Sure. And so I don't have any hard data or statistics on reasons that people have changed their mind if they were initially hesitant, but then did get vaccinated. I can tell you that, yes, I absolutely have spoken to people, a number of individuals who have chosen to get vaccinated. And while I've heard a variety of reasons, I think that a couple of the big themes that I have heard are just needing time to feel comfortable with their decision for whatever reason, and then they were able to do so. And the other one being that they saw the people around them who had received it, some as many as months ago, who were still doing well and were safe and not having any side effects, and felt like therefore it was safe for them to do.
Judy?
Thanks, Christy. Hi, Dr. Traxler. I just wanted to get an update on our vaccine ordering and allocation. I guess it was a couple of weeks ago when demand kind of dropped off and we stopped ordering our full allocation. Obviously not wanting any to go to waste. Can you just give us an update on where that stands?
Certainly. And so I know that we were still ordering just as needed. I am not aware for this week's orders, but certainly through last week, we were still ordering what was needed for the Pfizer and Moderna based on what was being requested from us by our partners, as well as what we would need at our sites and events. And then we have been trying to order 100%, and when it was available, we're ordering 100% of the Janssen available to us.
Zach Wilcox?
Thank you, Dr. Traxler. I appreciate it. Speaking about the incentives that you guys were talking about doing, and you mentioned that storage might be, an issue at certain locations, especially at state parks. I know that the fire department here in Myrtle Beach got a bunch of these freezers to help out with anything that they can. I was curious to see if there was any work that would be done with municipalities or agencies within municipalities to help facilitate those kind of things, both the beer with the shot and the state parks.
So certainly, I mean, it's potentially, an option. We also have, as well as a lot of our partners, a number of those portable freezers, which is excellent. Though certainly, even statewide amongst all the partners, there still is a limit to how many there are. Every piece of the logistics for these vaccines is just another part of the puzzle. Everything from literally the transport of all of the supplies, the transportation of these coolers themselves, these freezers, and the vaccines, to the staffing, to just even the setup, the space, to watch people afterwards. It's not as easy as just, carrying a lunchbox full of vaccine and people coming through, though I certainly wish it was. But so it's a number of these different pieces, but we are continuing to work with all partners, at all levels, and really encouraging our other partners, our other vaccine providers, to do the same.
Chris, you've got another question?
So to build off Judy's question, it sounds like we still do not have access to the regularly scheduled J&J doses from the federal government. Is there any update on that front as to when that might change?
And I don't want to speak for certain because I have not, again, seen or heard this week's allocations. So to know, and so I don't have an update for you on that front. But certainly, we'll share it when we have one.
Are there any other questions for Dr.? Yes, Judy, you've got another question?
Yes, I just wanted to get an update on the testing or the surveillance of variants, particularly variants of concern.
Certainly. So we are continuing to do surveillance. We are continuing to look for those, as you noted, the variants of concern. We do, we are providing those numbers to the CDC. Which is available, I believe, on their site. But I don't. Do you have a specific question, I guess, about the surveillance, other than we're certainly continuing to do it and to monitor and to partner with the CDC on that?
Yeah, I'm sorry, I lost connection for a moment. I was just wondering if you were seeing any trends in terms of seeing it being any variant being more prevalent, or if there's any really cause for concern about a rise in a particular variant, or if you feel like we have that under control. I mean, all of it kind of feels like we're moving in the right direction, but I know the variants are kind of a wild card, for lack of a better way to describe it.
Certainly. So I don't have the numbers in front of me to be able to tell you statistically if there's one, or which one is we're seeing the most of among the variants. But we certainly are continuing to monitor that and work with the CDC and with our epidemiologists to monitor it. I agree. We're seeing case counts and everything go in the right direction, but while there is the concern for variants, we continue to work with our federal partners and as well as our commercial labs in the country to stay ahead of that, hopefully.
Are there any other questions for Dr. Traxler? Looks like maybe Chris, you've got your hand up.
Thank you, Dr. Traxler. So when this federally run vaccination site in Columbia wraps up in 2 weeks, is that it? Is there any expectation that any more federal sites could come to South Carolina at all?
I have not been told of any imminent plans for one, but of course I can't, never say never. I can't say that for certain, but I am not aware of any immediate plans at this time.
Okay, I don't see any virtual hands raised, so I'm going to do a last call. Any burning questions from members of the media while you've got Dr. Traxler here?
I want to know why my lights aren't working, but.
Hey, Judy.
Hey, I'll go ahead and ask one more. No, Dr. Traxler is kind of building off of the plans to, I guess, use some innovative ideas to do vaccine distribution at state parks and at big events and festivals and all of that. Do summer camps, some of the bigger summer camps, especially as we're waiting for Moderna to come online with its EUA, would summer camps possibly be in that mix for vaccinating those adolescents?
I certainly would not rule that out. Our regional folks, our local folks, as well as our vaccine providers continue, as you note, to be extremely innovative and to really work to meet people where they are with the vaccines. Certainly one issue with the younger teenagers is needing to make sure that you have the parent or legal guardian's consent. So that would just need to be arranged ahead of time, regardless of what or where the event was. But I would imagine that could potentially be a possibility. Again, working on the local level with folks with those camps.
Are there any last questions for Dr. Traxler before we close out today's media brief? Going once, going twice. Okay. In closing, Dr. Traxler, I would like to thank you for putting up with flickering lights and such. Thank you for your time. As a reminder to the media, we will work to answer any additional questions via our Joint Information Center. And that concludes today's briefing. We will join you again next Wednesday. Stay safe this Memorial Day weekend.